Hello, my name is Nicholas Marudas, and this webinar is about a sports injury called dislocated patella. Dislocated patella is when the kneecap is completely moved out of its place. When this happens, the muscles, ligaments, and tendons on the inside of the knee become overstretched and damaged. This usually happens in athletics. Direct trauma or twisting the knee can knock the patella out of the knee joint. The knee is a complex joint with many different parts that function together to allow movement and provide support to the body's full weight when standing, walking, and running. It is made up of different structures including bones, tendons, ligaments, and muscles. They all work together to maintain normal function and provide stability to the knee during movement. The knee is a hinge joint made up of two bones, the femur and the tibia. The skinny bone beside the tibia is called the fibula. There are two round knobs at the end of the femur called femoral condyles that meet the flat surface of the tibia called the tibial plateau. The two femoral condyles form a groove on the front of the anterior side of the knee called the patellofemoral groove. The small bone highlighted in green in this webinar is the patella, and it sits on this groove and forms the kneecap. It acts as a shield and protects the knee joint from direct. The movement of the knee joint causes friction. To reduce this friction, all the surfaces involved in movement are covered with a white, shiny, slippery layer called articular cartilage and synovial fluid. There are two major muscles, the quadriceps and the hamstrings, which enable movement of the knee joint. The quadricep muscles are located in the anterior side and help the knee to become straight. The hamstrings are located in the posterior side of the thigh and help by bending the knee. Tendons attach muscles to the bone. We have the quadricep tendon that helps the quadricep muscles to attach to the knee above the patella. The patella attaches to the tibia through a tendon called the patella tendon. The hamstring muscles at the back of the leg are attached to the knee joint with the hamstring tendon. So, what is a dislocated patella? The patella normally sits over the front of the knee. It glides over a groove in the joint when you bend or strain your leg. When the patella dislocates, it comes out of this groove. What causes the patella to dislocate? Sudden change in directions, excessive twisting, hyperflexibility of the connective tissue, tightness of the muscle, and weakness of the knee muscles. Complications of the injury: swelling of the knee, feeling of the knee clicking, grinding, giving out, or popping out, sudden or intensive pain in front of the knee, or sharp pain of the knee during high-impact activities. Healing and recovering. During the first few days or until swelling goes down, it'll take 6 to 8 weeks for the knee area to heal and inflammation to go away. Most patella dislocations are treated non-surgically by relocating the patella back into the patellofemoral groove. In some cases, there is surgery involved. Physical therapy and rest are also part of the recovery. Here's an example of how a physiotherapist can help a patient to recover from a dislocated patella injury. Thank you for watching my webinar. I hope this information is useful. The information was taken from these sources.